Okay, let's take a look at case number 21. A 23-year-old sexually active woman presents to her physician because of a painful left knee and pain with urination. Physical examination reveals a swollen, tender, erythematous left knee with decreased range of motion. Examination of her skin reveals small papules with an erythematous base on her arms. Pelvic examination is notable for purulent endocervical discharge. What is the likely causative organism of this condition? Neisseria gonorrhoeae, through sexual contact with an infected partner. The vaginal infection can cause discharge and dysuria. If the bacteria disseminate, skin lesions, tenosynovitis, or septic arthritis can develop. Septic arthritis is a serious condition that must be treated aggressively to prevent permanent damage to the joint. How are septic arthritis, reactive arthritis, rheumatoid arthritis, and osteoarthritis differentiated? Synovial fluid white blood cell count is the best way to differentiate between the various types of arthritis. Osteoarthritis is the most benign and considered a non-inflammatory arthritis. The synovial fluid white blood cell count in osteoarthritis is less than 2,000 cells per millimeter cubed. Reactive arthritis, most commonly associated with chlamydia infection, leading to the classical triad of uveitis, urethritis, and arthritis, and rheumatoid arthritis are both types of inflammatory arthritis. The synovial fluid white blood cell count in these conditions is 2,000 to 75,000 cells per millimeters cubed. Septic arthritis, which this patient has, presents with a synovial fluid white blood cell count of greater than 100,000 cells per millimeters cubed, and gram stain culture of the fluid yields the causative organism. In this patient, what is gram stain of a cervical swab likely to show? Gram-negative, kidney-shaped cocci in pairs. However, the endocervical gram stain is insensitive and nonspecific and is best diagnosed by nucleic acid testing. What antibiotic is recommended for treatment of this condition? Ceftriaxone is a first-line treatment for gonococcal infections, particularly if disseminated. Patients with gonorrhea have a high risk of co-infection with chlamydia trachomatis. Therefore, patients are also empirically treated for chlamydia with doxycycline and azithromycin. If not treated early, what is a serious potential gynecologic complication of this condition? If the infection persists, it can develop into pelvic inflammatory disease. The bacteria can ascend to the uterus, fallopian tubes, and ovaries, which can cause endometritis, salpingitis, oophoritis, and tubo-ovarian abscesses. The infection and subsequent scarring can reduce the patient's fertility, as oocytes are unable to travel through the scarred uterine tubes. In addition, untreated infection increases the risk of ectopic tubular pregnancy. In advanced stages, fibrotic adhesions between the fallopian tubes, uterus, and liver can occur, and the condition is known as Fitzhugh-Curtis syndrome. Let me read that again. In advanced stages, fibrotic adhesions between the fallopian tubes, uterus, and liver can occur in a condition is known as Fitzhugh-Curtis syndrome. The grammar seems a little wrong there. Anyway, there you have it. Neisseria gonorrhoeae infection.